Welcome to the Comprehensive Multiple Sclerosis Nursing Update of 2021. This information is geared towards nurses that are interested in taking the MS certification. First of all, thank you for thinking about doing this. It's an amazing thing to be a MS certified nurse. I speak from experience. My name is Amy. I'm a registered nurse, and I got my MS certification back in 2014. I did it because I really wanted to be able to talk to patients and really say, yeah, I'm an expert on MS. And that's really the reason that I went ahead and did my certification. So today I just want to go over some important notes. Specific test questions will not be discussed in this program, and participation in this call does not guarantee you will pass the MSCN exam. An overview: the Multiple Sclerosis Nursing International Certification Board, or the MSNICB, endorses the concept of voluntary periodic certification by examination for all nurses involved in MS or multiple sclerosis care. Board certification in multiple sclerosis nursing is highly valued and provides formal recognition of basic multiple sclerosis nursing knowledge. In order to be eligible to sit down to take this exam, you must be a registered nurse, recommended to have at least 2 years of experience in MS nursing. The application fee is $345. However, current VA employees receive a $50 discount. Results will be mailed 4 weeks after the testing period ends. So there are 2 times that we test, one in the spring and one in the fall. Spring 2021 testing period, the application deadline is May 5th. Testing begins Saturday, June 5th and ends Saturday, June 19th. This upcoming fall, the application deadline is October 6th, 2021. Testing begins Saturday, November 6th and ends Saturday, November 20th. The testing format is a computerized exam. Testing time is about 2.5 hours, and there'll be 150 questions. Questions are multiple choice, and each question has 1 correct answer and 3 distractors. There will be no select all that applies. Preparing for the exam. We recommend that you study 2 to 3 times per week, starting 2 to 3 months prior to taking the exam. Later in the slides, we'll give you some resources. Additionally, consider a study buddy for accountability, or reach out to your local nurse that is already certified and see if she has some good ideas for you. Exam content. 23% will be concepts or underlying clinical practice. 42% will be assessment and intervention for clinical practice. 10% on advocacy, 17% on education, and 8% on research. Concepts underlying clinical practice will include the definition of multiple sclerosis, the pathophysiology of MS, diagnosis of MS and diagnostic criteria, diagnosis of relapses, clinically isolated syndrome, and the different phenotypes of MS. Assessments and intervention for clinical practice will include pharmacological therapies, symptoms and symptom management, psychosocial issues, assessment tools, alternative therapies, and pediatric concerns. Advocacy will include patient rights, ethical practice, negotiating the healthcare system, empowerment, community resources, and organizations. Education will include patient education, should be disease-specific, principles of teaching and learning, health promotion and change theory, comorbidities, developmental issues, cultural sensitivity, gender differences, resources and referrals, adherence, and professional development. Research will include terminology and process, protection of human subjects, evidence-based practice, translational research, and data collection. Some study references are the Multiple Sclerosis Nursing International Certification Examination Handbook for Candidates, This provides a detailed outline of topics covered on the exam and 10 free sample questions. This is available at this current website. Nursing Practice in MS, a core curriculum by June Halper and Colleen Harris. Make sure you have the 4th edition from 2018, and this will include practice questions and case studies. I found this one very helpful. Additional study references include the National MS Society. They have a great page that includes disease-modifying therapies and common symptom management medications. Managing Symptoms of Multiple Sclerosis by Randy Shapiro. This is a great book that goes over different symptoms like bladder. The McDonald Diagnostic Criteria of 2017, and there's a link there from the MS Society. And some additional preparations include online practice tests available at this website. Feedback will be provided on areas of weakness. Examples could be research or advocacy. Correct answers to questions are not covered. And then also, if you have a chance to go to the annual meeting this October, the Fundamentals of MS Care Track is amazing. It goes over lots of information. Additional preparations could include, and I highly recommend, an IOMSN membership. It's $50 a year. With that, you get a lot of online educational opportunities that can include things like regional in-person programs, different types of reading, additionally, a book that they'll send, or a magazine that they'll send out to you quarterly. The regional in-person programs typically happen in the fall. Because of COVID-19, right now that's sort of been halted. However, I do think the plan is to reinstate those this upcoming fall. So I would reach out to your regional liaison for more information about in-person programs in your area. Recertification. So once you get recertified, you are required to do it every 5 years. And if you go on the MSC IBC website, you can get specific requirements. Facts. So these are sort of common questions. How much do we need to know about DMTs? It's really important to have a thorough understanding of drug-modifying therapies. What is expected is including but not limited to FDA indications for each of them, mechanisms of actions, how they're administered, side effect profiles, and risks and safety concerns. A common question is, how in-depth are exam questions? The test is designated for RNs with at least 2 years of MS experience. The questions require careful thought, but reflect a baseline knowledge of MS. What kinds of research or clinical trial information is asked? Typically, the MS nurse's role and responsibility in MS research, different clinical trial phases, informed consent, what an IRB is, trial design, and evidence-based practice. What type of symptomatic treatments or medications are good to know? It's a really good idea to have a thorough understanding of symptom management. It's expected, including what medications are frequently used and how to manage the symptom. Here's a list of the DMTs that are currently FDA approved that you should be familiar with. Self-injected agents include glatiramer acetate or Copaxone or Glatopa. Interferon beta 1A, subcutaneous, Rebif. Interferon beta 1A, intramuscular, Avonex. Interferon beta 1B, which is beta-seron or Extavia. Ofatumumab or Concepta. Pegylated interferon beta 1A or Pelegrity. Some of the oral agents include clodrobine or Mavenclad, dimethyl fumarate, Tecfidera, diroxyl fumarate or Vumerity, fingolimod, which is Gilenya, monomethyl fumarate, ozanimod, siponimod, ponzimod, or teriflutamide. Intravenous agents will be oclarizumab, alemtuzumab, novantrone, or Tysabri or natalizumab. Thank you so much for listening to this presentation. Good luck on your upcoming exam, and if you have any questions or concerns, please reach out to your regional liaison through the IOMSN. Thank you and have a great day.